Hi everybody, welcome to This Week in Medicine, November 8th, 2021. I'm going to try to time limit this today because we have some Thanksgiving meal prep to do. So let's see if we can get through this quickly. Thankfully, not too much in the news. Again, this is brought to you by Foxhall Foundation. We do have a nutritionist who's rolling right along. Carrie is available to you. You can contact her through Inbalance Nutrition, PLLC@gmail.com. I think Carrie's doing a super job. We are so fortunate to have her. We also have our Active Masters classes. We have karate classes for kids and adults. We have yoga classes. So check out our website, Foxhall Foundation, and it'll have some links to our classes. What stressed you out this week? My anniversary didn't stress me out. We had a very nice 21st wedding anniversary, so thankfully that could still be celebrated despite the restrictions of COVID. We drove down into Louisa County, Virginia, which is a favorite place for us, and it was very nice. I'm glad to have my partner in life and partner in medicine working with me for this many years. You do need your vaccine card, although in some places not as often as others. But nevertheless, if you're going to, especially a theater venue, take your vaccine card. Vaccine for kids is still kind of stressful. In particular, some of the pediatricians' offices, I think, were expecting to get delivery of the Pfizer vaccine. And at least in Maryland, where my kids go to the pediatrician, our office is not going to have the vaccine. So similar to the struggles that we faced in doctors' offices in the District of Columbia, pediatricians' offices also may not have vaccine available. So if you're trying to get your child age 5 through 11 vaccinated, you might actually have to go to a pharmacy because the doctor's offices won't have the vaccine, similar to our office not having the mRNA vaccines. This is somewhat based on equity issues. If it's available at pharmacies and public health centers, then everybody can have access, whereas if it's just in doctor's offices, that limits access. So that's a little frustrating. How to interact with the unvaccinated. Thankfully, again, we have very high levels of vaccine in our area, so that's not as much of an issue for us. But even when we were down in parts of Virginia over the weekend, where the vaccination rates are low, people were still wearing masks, so at least that was reassuring, and they were following mask guidelines at various places throughout the county. Booster confusion still exists. It might be getting worse because of lack of availability of Moderna boosters. So people are struggling to get a Moderna booster or a Pfizer booster. We'll talk about that in a minute. Air travel safety is still a problem, especially as volumes pick up for the holidays. We're still trying to plan for winter holidays and getting your booster before you would go see somebody for Thanksgiving. And then Moderna scarcity is a problem. Again, the booster recommendations, it's okay to mix the vaccines. I did read from Johns Hopkins this week that the J&J first shot can be followed with Moderna 50%. So the recommendation is, even though the NIH study said you should get a 100% Moderna booster, the infectious disease experts at Hopkins are saying it's okay to get the 50% Moderna, even though it was the 100% that was researched in the NIH study. So if you are finding it challenging to get a booster shot, if you got one J&J shot, don't struggle too much with the 50% or 100%. If you can get the 50%, just go ahead and get it. Johns Hopkins Infectious Disease is backing that plan. Again, no one tested the 50% booster in the J&J patients, although certainly in the past couple of weeks we'll be able to collect that data because that is the only vaccine patients have been able to get. If you had Moderna, then you're going to get the 50% booster if you can find it. I know there's a little bit of scarcity on the 50% Moderna. And if you had Pfizer, you're going to go for the 100% Pfizer booster. Again, some special considerations. If you got J&J and you're a woman under 50, if you're concerned about the increase in blood clotting risk, which was actually pretty small, but nonetheless, if you're concerned, it might be a better idea to get Pfizer and Moderna. Quite frankly, I have not had a patient yet who has gotten a second J&J shot. It's pretty much everybody getting the Pfizer or Moderna booster. Similarly, if you're a man a young man and you're at all concerned about the myocarditis risk, which we have reviewed before, it's really a mild myocarditis illness from the vaccine. You could go with the second J&J. But again, I haven't found the second J&J shot easily accessible. So booster confusion, yes, some of this is based on Moderna 50% versus 100%. Do what you can. Do your best. These vaccines are outstanding. I don't think we have any vaccines in recent history that are as successful as these mRNA vaccines. So even if it's a 50% Moderna and not a 100%, trust me, it's still very effective. The Moderna is on the shelf for kids, and we should be rolling out soon the availability of the 1/3 dose Pfizer for kids 5 to 11. Remember this from October 8th? I had to go back quite a few weeks to find this slide. On October 8th, molnupiravir was discussed as a new drug, a ribonucleoside analog that prevents COVID viral replication. It was just approved this past week in the United Kingdom. It's not approved here by FDA yet, but at least they did submit the paperwork about 4 weeks ago. The trial was stopped because of success. So when these trials are very successful early on, the trial gets stopped. It was successful in preventing progression to severe disease if you took it within the first 5 days of your illness. It was a while ago that this drug was tested, so it was done in non-vaccinated people. It can also be used for post-exposure prophylaxis. So hopefully we will get this approved soon. However, as I said 4 weeks ago, Pfizer and Roche are working on the same. Roche makes a drug for influenza, so it's not surprising that they're also trying to make a drug for COVID. But Pfizer came out with their drug, Paxlovid from Pfizer, this week. This is Pfizer's website, so you can take it right from the horse's mouth. Friday, November 5th. This drug, Paxlovid, reduces the risk of hospitalization or death by 89%. This is astounding. There were 10 deaths in patients who were in the placebo group. So again, it's one of those trials that they stopped it early. They said they will cease further enrollment in the study due to overwhelming efficacy demonstrated in the trial, which is the same thing that they did for molnupiravir. So Paxlovid trial was stopped early because of its astounding success. You would give it to patients who are at high risk of progressing to severe illness. But that assessment, high risk of progressing to severe illness, is going to be a fuzzy category. It'll be up to the patient and their doctor to decide if they're at risk for severe illness. So I think we've seen this before. Obesity, high blood pressure, diabetes, immunosuppression. These are the people who are at risk for going into severe illness. But I'll tell you, patients who've asked for Tamiflu or Xofluza, where it's also indicated to take if you're at risk for high serious influenza, a lot of patients who are not at risk probably are getting Tamiflu and Xofluza for milder cases of influenza that isn't high risk. It was a perfect study, right? It's a randomized, double-blind trial, which we use as our gold standard for drug testing. So the trial design itself was excellent, and this drug is extremely successful. So already, this epidemic started sometime December or March, let's say, of 2020, and we're already at almost the end of 2021, and we have a drug this powerful, and we have vaccines this powerful. It's an incredible testament to scientific method, medical science. This actually happened really fast, and we should all be very excited and proud of all of the great, brilliant minds who were able to figure this out and figure out our vaccines, because this is really fast and very good medical science. So just to bring you back, since we're in influenza season, it's around the corner, there are 2 influenza medications, kind of similar to the 2 medications we just discussed for COVID, although these medications took a long time to come to market. You know how long influenza has been around, yet it took years to get Tamiflu, which is 1 pill twice a day for 5 days to treat patients who are at risk for severe influenza illness, or 1 pill a day to prevent for 10 days if you're in a household where you have exposure. So if a relative in your family that you've been exposed to has diagnosed influenza and you were with them, you could take a preventive pill of Tamiflu for 10 days so that you didn't get influenza. You can do the same thing with these other pills for COVID as well. There is a prevention or prophylaxis protocol for those. So Fluzа is a great medication that only came out recently. It's 2 pills taken at one time for influenza infection. It's very expensive, 2 pills, but I did give it to some patients in 2019. And I do remember one remarkable patient report. He had fevers, chills, he was diagnosed with influenza. He took 2 pills at night, and the next day he felt perfect. So this medication works, and it can also be used for prevention. Because it's only 2 pills at one time, you're kind of taking the same dose for prevention as you are for treatment, because you can't get much lower than the dose already, which is just a one-time dose. In the midst of our pandemic, this was used for prevention and approved for prevention in November. So a year ago, FDA approved this drug for prevention. So if you've had exposure to somebody with influenza, you can take 1 pill to prevent influenza. Again, this is Diabetes Awareness Month. Let's focus on prevention and diagnosis. So if you have your annual physical, you can talk about this. You can just get a simple hemoglobin A1C blood test to know where you are. And you probably should be tracking that at some interval. Maybe you get your hemoglobin A1C once a year. Maybe you get it if you lost 30 pounds and you want to know if your insulin control is better. So think about the blood test. It's very easy. Talk about this with your doctor. And again, let's not blame so much. It's less about blame and more about action. So don't worry about, did I eat too much candy at Halloween? Take the action, go get the blood test, see if you did. The blame game doesn't help you here. There's a lot of genetics involved. So are we going to blame being human? I don't think that makes a lot of sense. Instead of blaming, let's just take some more action and find out where we are. For fast pitch, again, it's Diabetes Awareness Month. Get a booster shot. Consider Pfizer or Moderna as your booster if you are one of the at-risk people. If you're 18 years old and you're completely healthy and you already had 2 Pfizer vaccines, you don't necessarily have to get a 3rd one. You're not at risk. But if you are at risk, and we discussed that in previous slides, get a booster. It's also okay to get your flu shot and your booster together, but again, you're talking about additive side effects, which really may not be necessary. You can spread these out by 2 weeks. Old school versus new school, you are what you eat. Again, this is Diabetes Awareness Month. Our future is the sum of our various risks. So if you have family risk for diabetes, if you are sedentary and you sit a lot, especially people who had to move to virtual work at home, it's a sum of the various risks, not just one behavior or one genetic risk. It's all of them. Tony's tip of the week, you don't need to fast for the hemoglobin A1C blood test. This is Diabetes Awareness Month. So if you want to be aware, get your hemoglobin A1C blood test. I was just asked today by a patient. She said, I didn't fast for today's appointment. Could I still get my hemoglobin A1C blood test? And I said, sure. It's a non-fasting test. Remember from last week's talk, this is a test that looks at the amount of sugar molecules coating a red blood cell. The red blood cell lives in your bloodstream for 60 to 90 days. So generally, it gives us an idea of what your blood sugar control has been for the past 2 to 3 months. And that's it for this week. Thanks for watching.